So hello everyone, my name is Joyce Kim. I'm the Marketing and Communications Director at Alight. And I'm so happy to be here with you all and welcome you to this live stream today. We're calling in from New York, and today I'm very honored to be sitting beside and joined by Mohammed Idriss, who
Hello.
is our Executive Director for Alight Sudan. Idris brings a wealth of humanitarian experience from the front lines. He leads one of our largest country programs for Alight, and he operates in one of the most complex environments, I would say, in the world right now. He's been supporting Sudanese communities through conflict and emergency, providing life saving health care, and it's probably one of the largest and fastest growing displacement crises in the world right now. So we're really excited to have you all here with us and for us to talk about what's been happening in Sudan. So Idris, thank you for being with us here today.
Thank you, Kim.
How has it
Thank you,
been
Joyce.
being in New York so far?
No, thank you very much. First of all, thank you for welcoming me. It was really a smooth trip, and it is rainy here in New York, and I'm happy to get back to New York after 2 years. And I'm happy also I will be able to go back and see New York Public Library again.
Oh, the New York Public Library is so beautiful.
Yeah,
Yeah.
thank you.
Just so you all know, Idris just got off a plane about 3 hours ago. So he hasn't even checked into his hotel yet. This is one of the first things he's doing to be able to share with you all. Just before we kind of move into the conversation, I want to once again welcome everyone that's here in the chat and kind of here joining us live. Please feel free to continue adding comments and questions as we go through, and we'll do our best to answer as many as we can at the end of this live session. We're going to do it for about 15 to 20 minutes, so make sure you get your questions in quickly. All right, so we did get some questions ahead of time, Idris, and some really thoughtful ones, but I want to begin on a more personal note, which is, can you tell me and can you tell everyone here a little bit about your journey? What initially inspired you to step into humanitarian work?
Yeah, thank you very much. It's a really interesting question, and I'm glad that you asked. I start my journey since just after I graduate, and I joined humanitarian work at Kalma Camp, which is currently the largest camp in Darfur, which is the region that's been hit by conflict for almost 20 years. And that camp at that time, when I start fresh, only 2,000. Now it's 200,000.
Wow.
And IDPs. What really inspired me from that journey is when you talk to the people, the trust that they show to you, and they start sharing their stories. And also, most importantly, you see the hope in the darkest days is really revealing. Mothers coming to nutrition center with their children that almost dying, but still holding a big hope that they will go through this time. They will go through this difficult time. It is really inspiring, and I did work for Sudan because Sudan is my country, and I am Sudanese, and it also take a personal inspiration that I serve my people during this difficult time. I did work outside Sudan for quite long time, but also I came back to serve my people and my country, especially during this difficult time. And like many other Sudanese, myself also I am displaced, and my family been displaced, but all our staff also been displaced, but we are continuing to do the doable as a light value, and ensure that the service is available for those at difficult time and going through this difficult time, and ensure that they have the meaning to continue their life. I can continue on, but this is really what inspiring me. Thank you.
Yeah, thank you, Idris. I mean, first of all, thank you for your service for the past 20 years. I've told you this before, but also thank you for your leadership of everything you're doing for the team in Sudan and for the communities who serve there. I am very honored to work alongside you and to know you. And yeah, I think that stat was really surprising. That Kalma camp, from 2,000 people, right? You said to now over 200,000 people. That just kind of shows it's an indicator of how fast kind of displacement has spread.
Yeah, and it also ensures that this conflict is really affect large population. 2000 since 2000 up to 2025 now. There is no decrease. People just increase in terms of number of displacement and level of the services that available for them because of, for example, Alight is there, but also they hold a lot of hope that they need to go back and they're looking for durable solutions. So we need to look at it. Yes, for last 20 years there is people out there is still in displacement status, and they need all of us to support them during this difficult time.
Yeah, I like what you were saying, that even when it does feel really dark, there's still hope that you're witnessing, right? And inspired by. So Idriss, as the Executive Director of Alight Sudan, as I mentioned, you lead one of our largest country programs serving 3 million people each year. What are some of your team's top priorities at the moment, especially now in the face of continued conflict?
Yes, thank you very much again for this question. But first of all, let me start by the word of gratitude and thank you for Sudan program and Sudan staff. Currently, we are 1,100 staff members providing services across Sudan from the east to the west and across all the areas that are affected by the war. The staff themselves are displaced. They lost their family, they lost their belonging, but even though still they show up and show up in our PHCs, primary health care centers, at our water point, at our women's center, and provide services to the people at need. This shows the dedication of our team, and also 99 of them are Sudanese, as I said, but also 99% also displaced, but still continue to come and provide services where we are. And also beyond that, we have staff that since the start of Allied by then was ARC, American Refugee Committee, is still with us. That also shows a commitment, and they also commit to Allied and commit to Allied mission and cause. So I want to say thank you and very much from deep of my heart, and because of them, throughout of the conflict, not the current conflict, but also through COVID-19, through the revolution, and many other conflict, either it is outbreak or flooding, is still Allied team show up and provide services, and we are almost in all these cases among the top 2 to 3 respondents, if not number 1. So that makes us really proud of our work in Sudan, and we always show up that we do it for ourselves because we are Sudanese, and also we are serving our community and our families. Top priorities currently for us is, as you might know, Sudan is now the largest displacement crisis in the world. Responding to this crisis, it needs a scale up of our operation, but also Sudan, unfortunately, since last 15 years, this is first time UN declare famine in Sudan. Not declare it anywhere in last 15 years in anywhere in the globe. Now only after 15 years, now declare it in Sudan, in Zamzam camp, and is expanding most likely to other location, most likely. So responding and scaling up malnutrition and treatment of children under 5 and women and pregnant women, that is a top priority for us. That is to ensure that there is alleviation of suffering and also prevent immediate deaths of those children and women. Also, part of this preparation, also rainy season in Sudan is coming in next 2 months most likely, and we are in race against the time to pre-position our supplies, ensure that team are available to respond during the rainy season, because when rainy season hit, it's possible to move any supplies or move even staff. So it's a real challenges. One of also top priority for us is the well-being of our staff. As you might know, is all of them displaced, been affected by the war. They also go and talk and listen to the people affected by war, and that also reflect on their well-being as well. So as a team and also global team did provide us with options in how we take care of our colleagues and our staff in Sudan, but also to mention that we are working in area there is no running water, there is no power, there is no communication. In all this, still Sudan team managed to deliver in 2024 reach more than 3 million across our operation. And this is not account for double counting. For example, people that same people, the 3 million, we provided them with health and nutrition, we provide them with water, we provide them with livelihood intervention. This is only as in simple, in summary, 3 top priorities, but of course the conflict is still going on, displacement is still going on, and we are continuously reprioritizing based on the context, based on the new realities.
Yeah, thank you so much, Idriss. I think speaking with you and listening to you, it is such a complex and layered crisis on top of crisis on top of crisis, right? So there's the conflict, there's famine, there's upcoming rainy season, there's issues with supply chain.
And outbreak of cholera. Still we are responding to
and health, the spread of health outbreaks.
Yeah.
And so, and yet, like you said, staff continue to show up. And so, as you said, thank you to the entire Alight Sudan team. You guys really do inspire us and really, are amazing despite everything that's kind of thrown in the way. So thank you. All right, so we have about a little over 5 minutes left, and I wanted to take some questions that are popping up in the chat. So one of the questions that I have is, what makes Alight's approach to supporting Sudanese communities unique?
Yeah, so again, we are proud of our approach in Sudan because it's really based on community. We are working with community since 2004, and still we are working with them. It makes our approach unique, but also our delivery is easy because we are working with community leaders, we are working with youth, we are working with women, and build that trust across for the last few years. This is as a, for example, in current conflict, when this conflict happened, our staff and our asset moved to the camps. We move them to the camp and operate from there. Throughout Allied, through the revolution, throughout the COVID-19, throughout this current conflict, Allied managed to sustain operation, and we are not one day stop any operation in any of those areas. And also, what makes us unique, we are working with the most vulnerable communities. And also we are working in hard to reach areas, and Allied in most cases is the only service provider with many services like health, nutrition, water, and livelihood interventions. It makes it unique because it's deep rooted in the community. And if we are there or not there, our community, our staff who are from the community continue to operate, continue to provide the service, even if there is no communication or no supervision, because they are with us minimum more than 10 years. They know and they have been trained in allied approach. We will continue. That also make us unique to also lead of few health initiative across Sudan, including 48-hour response project that is unique, first tested in Sudan, and Sudan Humanitarian Fund trusted ally with that approach. Yeah.
No, that's really incredible. And like you said, trust can't be built
Yeah.
overnight,
Yeah.
right? And so
Yeah.
this is years, if not decades, of building trust with communities and relationships. And I think that's so important. There's a couple more questions coming in. Well, you have a lot of questions, Idris, so let's
Good.
see. Let me skip ahead to this one. It says,
Yeah.
"Thank you, Idris, for this opportunity. How does Alight ensure that its interventions in Darfur are truly aligned with the needs and priorities of the local communities? Are community members directly involved in identifying those needs and shaping the design and delivery of those services?"
Yeah, thank you. As I just follow up was what I just said. We are not just go and show up and provide services. Normally, we talk to community leader, community representative before coming in and intervene. Providing our services is based on the needs, based on talking to the community, but more important, we co-create. We are talking to the community not because of their need and then we go and design. No, we know the need and also share that needs with the community and ask them to co-create the solution together. That will help us to sustain, to have relevant intervention, but also sustainable interventions, that because it came out of the community, and community is feeling part of being not powerless, powerful, because they have this intervention, they design, they continue, and they make sure that this intervention is designed by them is successful.
Yeah.
Because they are part of that participation, part of that co-creation. It's just not, we are not asking them just to provide their feedback. We ask them to be co-create and ensure that the solution is coming from them, and we are facilitator through this process, not in telling them what to do.
Yeah, no, I love
Yeah.
that. I think that is such a sometimes misunderstood aspect of
Yeah.
co-creation, that it's
Yeah.
not just feedback,
Yeah,
right?
yeah, exactly, not
Yeah,
feedback.
it goes beyond
It's
that.
go deep being ownership.
Ownership,
It's
yeah.
is coming from them, and when it's coming from them, it becomes their solution, not a life solution or someone's solution. So they do everything possible to make it successful.
Yeah, and I like what you said. We're just the
Yes,
facilitators,
yes, yeah,
right? We're kind of
yeah,
the backbone,
yeah,
right?
exactly, yeah, yeah.
I think that's great. All right, so there's lots of questions coming in. I'm going to take one more question, but I'll say this is maybe, do you have a decision between which of these two you'd like to address?
What is the plan to reduce malnutrition in Zamzam
Camp
camp?
in Sudan. So this
Yeah.
is where famine was
Yeah,
declared.
declared, yes. So there is, Allied is not working there, but Allied has responsibility of co-cluster lead in Sudan. And we are working with our partner to ensure that this is a top priority. In how to do that, first of all, we are working in bringing, as a collective community, NGOs and cluster of health and nutrition to bring supplies to the camp. First of all, to treat those malnutrition cases, to prevent deaths, immediate deaths. The second, to ensure that humanitarian access, advocate for humanitarian access and food distribution and healthcare to be delivered and provide to the camp of Zamzam, but also other camp as well. But this is a collective work, advocacy work. We are working with partner to ensure that this is not only Zamzam. Also, we need to work proactively. Famine is not spread to other camp because of not availability of resources. So that is a collective work, and there is a country humanitarian team working on that. UN are working on that. Government is supportive. and other actors also supportive to ensure that supplies are provided and humanitarian assistance are provided to those in need in camp and in Zamzam camp and also beyond Zamzam camp as well.
Yeah, no, I think that's a really important point that
Yeah.
even though famine was only declared in
Yeah.
Zamzam
Yeah.
camp, there's a risk right now
Yeah,
of it
exactly.
spreading in multiple parts of the country.
Yeah.
And also, I like what you said that we are working in collaboration with other partners
Yeah.
because these are big problems
It's a big problem.
that
yeah.
just
Cannot
Alight
be
can't
solved
do
by
by
one,
alone.
yeah.
Exactly. That was such an insightful conversation, Idris. Thank you so much. Thank you so much for being with us. Thank you so much for your leadership. Thank you so much to the Alight Sudan team for everything you're doing. It's really nothing short of incredible. And I think we're so grateful for your service and how you show up, as Idris says, every day and provide hope. And thank you to all of you for joining us today for this Facebook Live. I know it's kind of early Monday morning for some of you and maybe a little bit rainy where you are, but we really appreciate you joining us and asking so many thoughtful questions. And thank you for your commitment to standing with the people of Sudan in this time. So,
thank you.
Yeah. Idris, any last words before we wrap
No,
up?
thank you for showing up this discussion about Sudan. That you show up. It is too late in Sudan, and I see many of Sudan people from Sudan joined, but also from New York here and across the globe. We are deeply grateful for your participation in this. Thank you very much.
Yeah, and we'll have Idris, visiting with us for the week, right? Kind of doing a little bit of a U.S. tour. But I encourage everyone, if you're not already, please follow us on social media. We Are Alight. Please feel free to subscribe to our newsletter at wearealight.org. We'll be sharing updates, especially as we're approaching the 2-year anniversary of the conflict in Sudan next week. So we'd love to be able to share more with you all. And yeah, thank you so much again for joining us.
Thank you very much.
Bye, everyone. Have a good afternoon.